Hi, and welcome to the May Aging Well series. So happy you could join us. So glad you're here and not playing hooky on this absolutely gorgeous day. Maybe when everyone's been double vaccinated, we can get together and socially distance and try one of these in person for a change. But I'm glad you're here. Thank you for making time for us. We have got an amazing program for you tonight. Your two feature segments have a very international flair. Our first presentation is going to be the cooking demonstration, and it's actually straight from the pages of the March Our State magazine. It's actually the feature article on the Burke's Manor. Let's see. Yeah, the Burke Manor Inn, and the chef there is Chef Lille, and he is from France. And we had so much fun going down there. He was delighted to be a part of Aging Well. In fact, he took it to the next level and orchestrated an entire cooking class around me recording him for this webinar so that you would truly have a feel for being in one of his cooking classes. So before we jump into that, I always have to thank the team. So I thank Tom Roth, Courtney Hayes, Audrey Belfaro, and of course our speaker for tonight, Dr. Andrew Namen. These are all the folks that without all of them, none of this would be possible. And I always forget myself, so I'm Deb Burkham, and welcome. So we are delighted to get going. We have a lot to cover. So I'm just going to ask Chef Lille if you'd like to go ahead and take it away for us. And enjoy. Now you already have the recipe, so you may want to take notes. And one other point is he refers to a spider spatula in the recipe. And my husband's quite a chef in his own right. And so that's what this is. That's because I had never heard it called a spider spatula. So when he refers to it, that's what he's talking about. So Chef Lille, take it away.
Thank you, Deb, to invite me at Age Well. So we're going to have a good time, and thank you for being here. Okay, so beef bourguignon. Here we go. She's going to take that with her over there. All right. I'm going to have, on the beef bourguignon, a lot of people are using Dutch oven, and I love the idea to use Dutch oven. My grandma used to use Dutch oven. A lot of people cook it in the oven. Some other cook it on the stove. If you cook it on the stove, be very careful. It will cook very, very fast because it's a direct fire. I like the oven, and when you do the oven, you do the conventional. If you can take this one, I will bring it, and be careful, that's slightly warm. I like to use the conventional, not the convection. Because it needs to braise and it needs to render. So a beef bourguignon it's a meat that is, the term is braising. Do you guys know what braising means? The difference in between braising and roasting. Braising is roasting with a liquid. And you are going to have your dish, your content, your vessel here, and you are going to have your piece of meat. And if you put it like this in the oven and you let it cook for a certain period of time, you are going to roast it. The heat goes around and cook it from the outside in. If you are going to do the same thing like this, but you are going to put aromas, spices, garlic. On this one we do dry thyme, we do fresh rosemary, and bay leaves. And then you put an alcohol or you put any kind of liquid. Some people put water, and they just want to, they are more into infiltrating the flavor of the spice in the meat. Someone wants to do the wine. Or when you want to braise an item, you put that meat in here. And then you are going to bring the liquid all the way about 3/4 of the way. And you leave the head coming out. So what happens is that you have to cook for a long time at a very low temperature, slow cooking. The part that is in direct contact with the heat is going to dry first. obviously, because it's the only one that is not in there. But the fiber are going to call for humidity, moisture, because they are drying. And it's going to start sucking the juice around. You understand? So usually when you do a braising, you are going to use the spice that you love the most. Beef bourguignon, we go like this. So what I'm going to do very quickly, I'm taking a nice piece of bacon. I'm going to take that away. I put it over here. I'll lower that. I'm taking my knife. Can you make sure you have at least one great knife at home? And I don't make money out of him, but his name is Bob Kramer. He's an American maker and he makes knives that are amazing. That's a Bob Kramer. They are not cheap, but they really do the job. All right, so we have the bacon here. We have a low fire. We have a touch of oil. And then we are going to take the bacon. And we are going to let it sweat. We're not going to cook it. We're going to let it sweat. We're going to make him do some exercise a little bit. All right? He's going to sweat. He's going to bring a little fat to the content. And I'm going to keep that as a flavor. While this thing is going, I'm going to take my meat. Oh, here it is. And I'm going to take that like this. So I have marinated my beef. You can marinate for an hour, 2 hours, 3 hours overnight. So when I'm going to cook that, I'm going to take that beef and I'm going to just dry it. Do you know why I'm going to dry it? Do you remember when I was talking about searing? And now it's not just an easy fillet that I'm going to sear with just two sides, is that all the sides here will have to be seared in order for me to manage to keep some of the blood inside. Okay? So I'll go like this, tack, and I dry it. All right? Once it's here and smiling to me, I just give him a little bit of salt, and because it has been behaving, oh, we took my pepper. Where is Miss Kate? My pepper, yes, please. Okay? So I'm going to pepper it when it's there. So I have my bacon rendering, a little bit of oil, and now I'm okay. I'm going to add the pepper. So you have to be very careful because there's going to be for all different reasons. That's why I'm going to talk quickly. It rendered, you have oil and it rendered fat, and here you have not only you have a liquid, but you have also wine. So usually you have to be very careful because if you put a liquid water in oil, it's going to be very bad. And if on top of that you have alcohol, the alcohol is going to go very quickly, and that's where it burns, and that's where everything catches on fire. So make sure you dry it. That's if you do a big quantity like we do in the kitchen. Okay? And I'm going to sear it. You see? I'm searing it. You hear the bubble at the beginning? Big bubble. Pa, 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 pa. And the more it's going to cook, the less liquid is going to be in there, and then it's going to be, like the big quick. Okay? So we have that going. All right, and then I'm going to make sure that I seared every side. Be careful, you don't want to cook it here again. You want to sear it. Okay? So you want, if you have a cube, you want this part, this part, this part, but you don't want to cook them because they're very tough. So you want to keep going like this. And when you are about where you want to be, you see, like I show you one of the piece, for example. Okay, oopla. You see? Even a little more, just to give it a little color. I'm going to decant it. I'm going to take it off. Put that on the side. So I have my meat and the bacon dancing together. All right, so bam, that's going. And now I'm going to take advantage that I have this, now I kept a little bit of the fat of the bacon. That's where I'm going to put my carrots, my onions. Who can tell me the name of the carrots, onions, and celery? We use that in, beautiful, beautiful. It's called mirepoix, M-I-R-E-P-O-I-X. And I don't say cut onions and I see that in mirepoix. You know, every braising liquid and every soup that I do, and God knows I do them every day, always start with mirepoix. You have the flavor, it brings all the things that you need. All right, so with our mirepoix, our meat is seared, the bacon is happy and dancing. And then what I'm going to do, I'm going to bring the fire. And do you know, when you cook, okay, can you see at the bottom the little black dot? Mm-hmm. Can you see at the bottom the little black dot? Yes? Okay. I'm going to show you. You see those little black dot here? Mm-hmm. Mm-hmm. See those little black dot here? I don't know if you can see them in the camera, but all those here. Okay? Those little black dots here. Glace. Glace. Or suc. S-U-C. Suc. Glace, translated, become glaze. Suc is the base of sucre, and sucre is sugar. Caramelization is usually with sugar. We are caramelizing our vegetable, and we are developing a glaze. That suc, that glaze, is the most important part on that dish. That's the flavor. That's the thing that managed to burn just at the right level without the scent and the taste of burned, because it was protected by its own moisture or by the vegetables that are around. That's pure gold. When you do that, you want to preserve that. That is born now and is going to be there for 5 hours all the way until it's in your plate. So I need to save it. So what am I going to do? I'm going to deglaze. Deglaze, listen. And that beautiful sound, it's a big wine that is grabbing all the little baby glaze together, and he has them in the juice. All those little black dots here are now in the juice, and usually you take a little spoon and you help the one that are behind. Hey, come in the pool. Don't be shy, come and try. All right, we put that in there. So now I have amazing vegetable, Trinity or mirepoix, that are rendering in a bacon oil that turn into suc, that just got deglazed with red wine. Just that. Come on. It could be worse. And then, when it's like this, I'm all happy. I'm going to do a little bit of salt, a little bit of pepper, and I'm going to do rosemary, bay leaf, and dry thyme. Boom. At this point here, I'm going to lower my fire because I don't want to cook my meat right away. And I'm going to empty back all my meat and my bacon in there. They are ready for this dance. They are ready for this dance. They are excited. It's little kids going to prom. And then I'm taking my veal stock or beef stock that I did with a beef glaze, with a little bit of water added, and I'm just going to pour it almost all the way to the top. Do you remember the head needs to come out, because that's like this, that is going to dry and suck that beautiful juice with the suc and the wine and the spices, and the mirepoix is going to suck all that in the meat. Okay? And when we're like this, you are going to take, you can do a lot of different, based on the container you have, you know, if you do like in the Dutch oven, or if you can enclose it, you can steam it, you know, you can do a lot of different things. You can cover it with aluminum foil, or you can put it with some of your saucepan or some of your pan will have their own lid. as long as it's covered, because you are going to cook it very slow. And it's very easy. The reason why I like to explain sometime and take a little path is because it will help you to remember those examples. What's going to happen here when it's cooked, when you cook a liquid, what is happening, a liquid or solid, but you see much more with a liquid. The heat comes from the bottom, and the water is going to start boiling. So when you boil and you see bubble, so it means that in fact it's the liquid that is going to be first getting transformed in vapor and go, and fortunately disappear in the Milky Way. I don't want that. It's my gold, it's my little baby glaze in there. I don't want him to go anywhere. Don't go nowhere. So I take that and I'm going to put it on top. And now it's going to go, but it's going to touch the ceiling, cool down, and come down as a juice. And I'm going to do that for 4.5 hours. It's going to suck, some is going to go, so it's going to get it from the bottom, it's going to get it from the top, it's in a pool, and it's raining. Okay? Low temperature for 4.5 hours. All right? You will not be able to believe how of an amazing chef you are, because it cooks slowly. The nature does everything. You just have to put your little spice and a little wine and just let it go. You are going to have the entire house that smells like paradise, and you will eat it, and it will be so moist, and okay? And that's how you do the dish. That's how you do the beef bourguignon. Keep the juice, so then after, from there, when you are going to come, evidently you are going to have a little less juice, because after 4.5 hours some have disappeared, and you can go. So what I like to do, I didn't think she did that today, but what I like to do, if you serve it with your big family, you can do the juice because it's very healthy and it's fancy, but I like to take a calendar. Nobody sees that, you're in the back. You pass this meat very slowly. So usually you take a spider. You know what a spider is? That's the big, it's a big spoon. When you fish pasta and things like this, a flat big spoon, like it looks like it's a spider. It's a spoon / calendar, and you take your meat and your solid and you put them on the side, or you empty them in a calendar. In calendar, you have to be very careful, especially if you have a lot, because it's very fragile and you are going to squish them. The bottom one is going to be so you just put them on the side, and then you keep the juice and put it on your stove, and you do a slurry, or are you using cornstarch at home? Yes, a little bit of cornstarch and water, which is very often, now it's very, people are like, I don't want to do cornstarch, and it's not a real roux. Roux is flour and butter, but now everybody is allergic to gluten, so cornstarch is very big back, and you do a little cornstarch, and you thicken a little bit that braising juice, and then you put back your meat in there. Now you are going to have each piece of meat coated with that delicious juice. Okay? I hope everybody enjoyed it.
Oh, yeah.
And that.
I will tell y'all that Chef Lil is mostly chef, but he's also a showman and a storyteller. So it's quite an event. I highly recommend a trip to Gibsonville to the Burke Manor Inn, and make sure you book a dinner, maybe a cooking class there, but it was a wonderful, wonderful time. And now for our second feature, I feel like now we got to work off some of these calories we absorbed while we were watching the chef. A good friend of mine, Carlo David, is a Wake Forest trained exercise physiologist, and he is one of the master trainers on the US Pointer study. He is phenomenal, and he is from South Africa. So you were going to hear another beautiful accent. And so, Carlo, get us ready to work off some of those calories.
Deb, and thank you for allowing me to be a part of the Aging Well series. As you can see, we are in the backyard here, and we can do these exercises anywhere and in any place that we want to do them. And so we want to make sure that we are going to provide you with an opportunity to do stuff that you can do at home as well. as an exercise physiologist, a lot of times what we focus on is getting people to do aerobic exercise, to do strength training, and what we sometimes forget is really emphasizing that stretching component. And so for today's video, I was going to take a few minutes and just go through some stretches that you can do on your own. And we'll start with some breathing, and then we'll move from the neck and we'll move all the way down the body as we go through them. So if you're ready, grab your chair, sit up, and we will get going. So to start, I'll have you scoot a little forward in your chair, feet about shoulder width apart, and we're going to start with some breathing exercises. The exercise will be today will be a little bit of an adaptation from some yoga stretches that I've learned over the years. And so I will just start with some breathing and then we'll get into the exercises. So what we'll do is we'll sit up nice and tall and we'll just take a deep breath. Hold it for 1, 2, 3 and let it out. So you want to make sure you're taking a deep breath through your nose and breathing out through your mouth. And in and out. That's 2 and 3 in and out. That's 4 and in and out. That's 5 and last one in and back out. So now that we are a little bit more relaxed and we're kind of comfortable, we're going to start with our neck stretches. And what I'm going to do is I'm going to have you sit up nice and tall again, and we'll start with some neck rolls. And what we'll do is we'll just start rotating our neck from right to left, and we'll do these 5 times. So 1, nice and slow, make sure you get a full extension, the full range of motion. 2, all the way back around, and 3 and 4 and last one 5. So of course if we go the one way we have to go the other way too, so we'll go this time we'll go from right to left, and we'll go 1 and 2 and 3 and 4 and 5. So the first few minutes here, I'm really going to focus on the neck and the back of your shoulders and your chest and your back, because I know right now we have a lot of stress going on. So I want to just make sure that we get rid of some of that tension that we might have in those areas. Next, what we'll do is we'll do some shoulder rolls. And what that will entail is just rolling your shoulders all the way back, making as big a circle as you can with your shoulders. And we'll do the exact same. We'll do 5 each way. So we'll do 5 forward, and then we'll do 5 going backwards the other way. And 1, so nice and big. And 2, and 3, and 4, and 5. Oh, nice and loose. That felt good early in the morning. Next, we'll go back, and we go 1, and 2, and 3, nice and big. Make sure you make as big a circle as you can, and 4, and 5. I hope I'm not the only one hearing my shoulders cracking. That feels pretty good. So that's the first 2 is just really rotating that neck and those shoulders. So now that we've done all our deep breaths and we are nice and relaxed, we'll start off by doing some stretches, and we'll start at the neck and we'll move all the way down. So the first one we'll do is we'll sit with our feet shoulder width apart, sit up nice and tall, relax your shoulders, and what we'll do to start is just look to the side, come back to the middle, look to the other side. Once you're at that stretch, hold it for 1, 2, 3, and then come back to the middle. So we will do that to each side, and we will do that 5 times to each side. One little tip is when you look to the side, you can actually get a bigger stretch if you just relax your shoulders and pull a little to the opposite side with the opposite hand. And that's really going to work that neck muscles that you rotate. We can also do the same thing. We will do the same thing afterwards. And this time what we'll do is we will rotate to the side this way and hold for 1, 2, 3. Sit up nice and tall. 1, 2, 3 to the other side. And so when we do these, we want to make sure that we are relaxing our shoulders as we do the stretch. Similarly to the other one, you can also enhance the stretch by, once you lean over, actually pulling down a little bit to stretch that neck a little bit more as well. So those are some stretches for your neck. And so right now, a lot of us have a lot of tension in our shoulders, tension in the neck because of all the stuff that's going on and all the stress we might have. And so the next stretch is really going to help with some of that. So you're going to sit in front of you in the seat of your chair, and all you're going to do is you're going to hug yourself, and you're going to try to extend and round your back as much as you can. So you're going to hold it, squeeze it, extend that back, hold it for 1, 2, 3, come back to the middle, and then just go the opposite side, interlock your hands, and open up that chest as far as you can. So 1, 2, 3, and we'll just do the same thing again. We'll squeeze nice around that back. 1, 2, 3, and stretch it at the back as well, opening up that chest. 1, 2, 3. So the same with this exercise. You can do this one doing 3 to 5 times holding in the front, and 3 to 5 times holding in the back as well. The next exercise is going to be a lateral reach, and that's really going to target these muscles on the side, or your latissimus dorsi, or your lats as everyone calls it. And so this one, all you're going to do is you're going to sit up tall, you're going to reach up above your head, and you are going to lean over to the side. And count for 1, 2, 3. Come back to the middle, and nice and slowly, try not to rush into the stretch, nice and slowly reach over and extend that arm and try to push out that lat as much as you can. And 1, 2, 3. The exact same thing with this exercise is that we will do this one holding it above into the stretch for 3 seconds, and we will do it about 3 to 5 times going to each side. The next stretch is one of my favorite stretches. I'm from South Africa, so I call it the cat cow, or the cat camel. That's what I call it, but I guess no camels here, so you guys call it the cat cow. And so this is one of those ones that's a modification on some of the yoga stretches. So instead of going on all fours, you can sit in your chair, and I'll turn to the side for this one so you can see it a little better. But you're going to sit in your chair nice and tall, and but you're going to place your hands on your knees, and you are just going to round your back as much as you can, and you're going to hold that for 1, 2, 3, and then what you'll do is you'll slide those hands back, and as you slide them back, push your chest out, try and arch your back as much as possible, and look straight up into the air and hold that for 1, 2, 3. So once again, you're just gonna roll forward, hold that stretch right there, 1, 2, 3, and then open up, look up into the air, 1, 2, 3. So that one feels probably the best out of all of them for me, so definitely one to keep an eye on. One thing that I want to stress, and something I might have missed earlier, is that as we're doing these stretches, try to always be breathing as well. Don't hold your breath during the stretches. Try to always have like a nice slow breathing rate, but never hold your breath. Always try to keep breathing as you are doing them as well. So those are really going to be the targets for our upper bodies. And so for the next little stretch, I will come up to my chair, and I will push it out in front of me. So what we'll do next is we'll do some of those modified yoga stretches as well in the standing position. Some of these will help with stretching, but they may also help with some of the balance activities as well. So the first one is we'll do a downward dog stretch. And so you're going to put the chair out in front of you like that. Place your hands on the back of the chair to make sure you are balanced. You're going to take a few steps back. So I normally start out here, take 1, 2, 3, 4 steps back. And all you're going to do is you're going to push your butt out, and you're just going to lay down and try and keep your back as straight as you possibly can. So you'll do this position. You'll hold that stretch for about 10 to 15 seconds. You'll feel a good stretch in the back of your hamstrings and in your lats and your shoulders as well. And so that's going to be a really good stretch that targets both of those areas. So you can do it just holding it for 15 seconds, coming back up, and then doing another 15 seconds that way as well. A stretch to follow that stretch up, and normally these two work together, is once you start out with your stretch like that, you can come back up, walk it in, and this time, instead of pushing your butt out, you're just going to extend back and stretch out some of the muscles in the front and really help with that flexibility. So you'll just lean back as far as you can, hold for 1, 2, 3, and then come back to the middle. So those are going to be really good stretches for really your top of your thighs, your chest, and also your abs as well. So those are really the ones for your upper body and your lats. The last two I was going to show you guys is the Warrior 1 and the Warrior 2 stretches that you normally see in yoga. So this is a modified version for older adults as well. So this time you can put the chair on your side. So this is going to be targeting the front of my right leg, and this is going to be Warrior 1. You put your one foot forward. 1 foot forward. You can have a slight little bend in your back knee and lift up that heel a little bit. And all you'll do is you'll just lean into it, and you should feel a stretch going down the back of your thigh. But you can just arch back, and that will really enhance that stretch. As usual, you have the chair here for balance, so you can keep a hold on to that, and that will help as well. But the main thing is really just trying to drive those hips forward, keeping them both facing forward, keeping your back foot facing forward, and you should feel that stretch going down the front of your back leg over here as well. So that is going to be that first stretch. And so you can do that for both legs, and once again you can hold it for about 10 to 15 seconds and then switch to the other leg. The other pose that we can do as well, and I'll come over here for this one, is we can do the Warrior 2 pose, and that's the one where you have your one foot facing forward, the other foot facing perpendicular, so straight ahead in front of you. So your feet should be kind of in that position, if that makes sense. And all you'll do this time, and once again you can hold on, and normally I'll put the chair in front of you, but obviously we don't want to block the camera. But so you can hold back here, and all you'll do is you'll just lean in, and this time you should feel that stretch going along the inside of your leg. And if you feel a little more advanced, you can do the full stretching out of your arms, and you can feel like you are actually doing a yoga stretch as well. So I will come back to my seat, and so once again those are going to really be some basic stretches that can really target all the way down to the bottom of your body. And so once again I want to thank Deb for this opportunity to be here with you guys and just share with the Aging Well series. And like I said at the beginning, flexibility is really important, and we can do it anywhere, anytime, and hopefully you benefited from this. But I really appreciate it and really enjoyed doing this for you guys. Thank you.
Thank you, Carlo. He does such a beautiful job. And again, you've heard from Laura Baker on one of our segments about US Pointer, and he's one of the master trainers on that program. So I'm always so grateful to these folks who enthusiastically step up and say, we want to be a part. How can we help? And that goes in tenfold to Dr. Namen. Dr. Andrew Namen is a sleep specialist. He's a physician at Wake Forest Baptist Health. And he was one of the speakers when we were doing these live that, again, just got rave reviews. So I'm tickled to death that he was available and eager to be a part of our virtual series. And I just want to remind y'all, if you have questions as Dr. Namen is presenting, please put them in the Q&A section across the bottom. And that way, towards the end, we'll be able to address any of your questions. So without further ado, it's my pleasure to introduce Dr. Andrew Namen.
Thank you, Deb. I appreciate it, and I appreciate the folks at the Aging Well series, and thank you again for the invitation. I will have to say the Burke Manor Inn is a wonderful place with great flavors, and the folks at the Pointer Study are just on the avant-garde for research for those for us older folks. So without further ado, the title of this talk is Aging Well and Sleep Better. And what we want to try to do is go through a couple of topics. First of all, what happens to our sleep as we get older? I mean, most of y'all are experiencing it, and just to share some common concerns that as time goes on, and some epidemiologic research that has helped us understand this problem. Also, to better night's sleep. We'll talk about some good and bad behaviors that have been adopted by folks over time, very common, and things we can do to minimize those bad behaviors and enhance those good ones. And then talk about common sleep disorders, especially those that are associated with adverse events or things that really complicate our sleep, making sleep even more challenging, even despite our age. And then talk about kind of some of our focused interests at Wake Forest of our progressive perioperative sleep screening program here, really intended to improve the lives of our patients, reduce problems after surgery, and actually improve their sleep life well beyond surgery. So, some sleep statistics. Yes, sleep problems are common. Up to 70 million Americans suffer from disorders of sleep and wakefulness as a result of sleep problems. 60% of those are chronic, meaning longer than 6 months. And then each year, sleep disorders and sleep deprivation and sleepiness add a nice financial hit to our healthcare budget of up to $16 billion. But what we know about sleep and what we should aspire to do is get a lot more sleep. Sleep is restorative. It helps us feel refreshed after a good night's sleep. It improves our ability to learn and some other cognitive functions. It also improves our memory, impacts our sexual drive favorably when we get a lot of sleep, and aids in preventing illness. And I'll go into some detail regarding that. When we think about sleep and we think about how good it is, some of our learning comes from what happens to us when we're deprived. And major things that have happened, you know, for some of us can remember the Exxon Valdez. Much is being said about motor vehicle accidents, especially among truckers who are sleep deprived or have sleep disorders that results in sleep deprivation. Other things include what happens when you're chronically sleep deprived, not just the sleep disorder of one specific concern or another, but it increases high blood pressure, heart-related diseases, and something called increased heart age. And that's the last thing you want to know, is that you've increased your heart age when you're already aging. And then the other things is it increases our absenteeism at the workplace, as well as the more we're sleep deprived, the more you'll see increasing weight gain. So what about older adults? Well, older adults in general feel like sleep is less satisfying than their younger comparators. They also feel like they take much longer to fall asleep. That's what we mean by latency. They also feel like when they finally fall asleep, they wake up more often than they did when they were younger. And then they also see that they don't get into that real deep sleep that they used to be so easy for them when they were younger. So when we look at epidemiologic and physiologic data, we see something that happens as time goes on. Specifically, that as we go from younger age to older age, the amount of sleep latency, how long it takes us to sleep, increases. The wake after sleep onset goes from not being that much of a percent to increasing as we get older. Our real deep sleep, REM sleep, and slow wave sleep, both of which get dramatically much smaller in percentage of our total sleep. And as you can see, you get a significant increase in stage 1 sleep and stage 2 sleep as we get older, with resultant reductions in both REM and slow wave sleep. Well, that's probably why we don't feel so good when we wake. One of the things is what we found in national survey data is that people tend to get less sleep while in bed. And if you can find that over 3 in 10 adults will average about 6 hours sleep or less. And it tends to get worse as we get older. And here's a nice graphic showing that as we move farther away from 7 hours of sleep to less sleep, our risk of death increases. Similarly, as we move farther away from 8 hours sleep, risk of death gets worse. Well, people say, well, why does this happen? The longer we spend in bed may be associated with chronic illnesses and things like that. But what was clearly evident, no matter what the age of the person, less time in bed, less time asleep is associated with worse events and increased mortality. This then brings up some more detailed physiologic questions. Well, why is that? Well, this development of something called heart age, a compilation of certain physiologic measures that were put together. And what we find is that the heart age increased in years as we move farther away from 7 hours sleep and to less than 5 hours of sleep. You lose age. You increase in age and you lose time and health, increasing mortality. What we also know is, again, as we move farther or closer towards less sleep, dramatic increases in the prevalence and odds of developing diabetes. So sleep deprivation, less sleep, some people start saying, you know what, I'm having problems maintaining sleep, or I'm having problems falling asleep, both of which are significantly different from the other, but both of which creates a sense of insomnia, where you're not able to stay or maintain sleep or go to sleep. And up to 40% of patients over 60 suffer from this concern. And it is oftentimes attributed to waking up too early in the morning or just staying up all night. So what are the components that trigger this problem? Well, sometimes behaviors play a big part, something we may have adopted early in our life and kept it going, but it seems to be making more and more of a problem for us as we get older. But one of the things for our current generation of young adults, but also affecting our older adults, is bright light exposure at the time or 2 hours at least before bedtime. That bright white light or blue light creates so much arousal that even after we fall asleep, even when the light is gone, it continues to cause arousals while we're asleep. So you can have these micro arousals from deep sleep to wakefulness just because of that exposure of bright light prior to bedtime. Similarly, caffeine use up to 4 hours prior to bedtime has been attributed with multiple arousals. So, and then of course, for us, for those folks that are frequent travelers, that those abnormal sleep cycles, or those folks that were, quote, a morning lark, or those named a night owl, also can develop progressive changes within their sleep, making it more challenging. And then common things within our society like alcohol or prescription drugs that are sedatives can actually cause some disruption in our sleep. So we always advocate exercise, and exercise is always good to assist us in sleeping as long as you do it at the right time. You never want to exercise raising your core temperature prior to bedtime. That will cause arousals and multiple awakenings. Whereas if you do exercise as soon as you get up or early in the morning, it will actually help that sleep homeostatic drive to help us fall asleep more appropriately at the time our body and our physiology wants us to. And then, of course, remove those distractors in bed, specifically pets that may come to the bed or grandkids or kids. helping to influence them to have good sleep habits by keeping them in their bed, but also securing your better sleep. So again, light emitting devices clearly creates these type of struggles of initiating and maintaining sleep. These light happens to be the most potent stimulant of our suprachiasmatic nucleus, which helps us with our circadian rhythm. And so if you think of how this all works out, the circadian rhythm and our ability and the suprachiasmatic nucleus influences our core temperature. So as we approach wake, our temperature rises. As we approach sleep, our temperature cools. The best example are those young kids that are always so cold just before they go to bed that you have to wrap them up, and they love to snuggle and get a little bit warmer. That natural core temperature fall helps us initiate other things to help us fall asleep. So, but light is not the only trigger. Other things like melatonin. And unfortunately, as we get older, the pineal gland tends to make less of it. It also develops, the suprachiasmatic nucleus has fewer receptors, or the receptors actually degrade. So the relative concentration and sensitivity to naturally producing melatonin doesn't have as quite of a good of effect as it used to. Sounds bad already, right? Getting older ain't for sissies. So again, this phenomenon of melatonin actually can hurt even some of our more vulnerable folks that live in nursing home, in which when they have such little or restricted bright light during the day, because they're always indoors, those community dwellers, they tend to also have difficulty in disruptive sleep behaviors. So we commonly talk about those folks, as we get older, a common circadian rhythm is advanced sleep phase syndrome. And what that means is that's sort of the morning lights. I want to go to bed early and wake up early. Well, what tends to happen is, because of that natural tendency of us waking up, it tends to disrupt and make our sleep less consolidated. As a result of it making it less consolidated, we tend to wake up earlier in the morning, sometimes advancing so quickly you're waking up at 3 and 2 in the morning, going to bed even earlier, like 7 or 8 at night. What happens? Well, you get up in the middle of the night. It's dark and people fall. So we always try to help folks understand to really try to keep yourself in the natural sleep rhythm. Push yourself against that tendency of going to bed early and waking up early. Actually use bright light at 7 at night. So it pushes your wakefulness, or pushes you to maintain wakefulness until about 9 p.m. So you're not waking up so early in the morning. And this is a depiction exactly what I'm talking to you about, where the standard phase of going to sleep is somewhere around 10:30 and waking up around 7:30. But that advanced sleep phase person, that struggle that occurs as we get older, where we start wanting to go to bed at 7 and waking up at 3. Well, let's add some light to the subject right here at the 7 to 8 o'clock window, so it can help us push to that natural 10 o'clock and avoid bright light early in the morning. And the reason why is, if you start doing that, that will again keep you to stay awake for the rest of the morning. So if you do happen to wake up at 3 or 4 in the morning, keep the light lit, the room dimly lit. Stay in bed. Practice relaxation techniques and get up at 6 a.m. So again, insomnia is not only for thus getting older, but also for elite athletes. And the reason why I bring this slide into it is that it can happen at any age to start, and it can be constantly promoted with our behaviors as we get older. And the reason why I mentioned the elite athletes, these guys like to fall asleep just like anybody else. but their late exercise routines creates that problem. So this is, again, my reminder to tell you guys, please do not exercise late at night, okay? Keep it easy at night, exercise early in the morning, and practice cognitive behavior therapy, which is the safest and still the most effective long-term therapy for the treatment of insomnia. So again, recap those slides. Avoid caffeine and nicotine use 6 hours prior to sleep. Strict adherence to sleep time and wake time. Avoidance of late night meals or snacks, because that too can drive us to stay awake. Early evening or morning exercise routines. Caffeine use prior to should only be restricted in the mornings. So let's get to common sleep disorders for the next 5 minutes. And the two most common that we see in the sleep lab are restless leg syndrome and obstructive sleep apnea. I want to read these questions out to you. Do you have creepy or crawling sensation in your legs, particularly when you're resting? Does it begin or worse at rest? Relieved when you pump your feet or try to get out of bed? Or worse in the evening or night? If you answered 3 of those questions favorably, then you probably have restless leg syndrome. And these are conditions that are commonly associated with things like kidney disease or neurologic injury, can actually happen among family members and can be successfully treated that way. But it also can occur as we age. This is what it looks like. It's a repetitive movement in the legs, particularly in the first third of the night, making it difficult to fall asleep. And it's a constant 90-second event. Then this leads to the most common sleep disorder we see in the sleep lab, sleep apnea syndrome. So we don't really commonly see people with sleep deprivation issues or insomnia in the lab unless it's been going on so long and we suspect a breathing related disorder. But apnea is the making effort to breathe, but no airflow for at least 10 seconds with a 4% drop in oxygen. There are 3 categories: obstructive, where you're making effort and no breath; central, where there's no effort, no breath. And then there's something called hypopnea, a reduction in the airflow for about 30%. And that gives us this number called the apnea-hypopnea index. And if you have sleep apnea, you probably have heard that number. And that helps us measure severity. What we know is that the prevalence of sleep apnea is rising year over year throughout the country, probably related to obesity rates. And it's achieving about 20 to 26% of the population. But the unfortunate reality is, and this has been done on 2 studies, is that up to 80% of men and 90% of women with symptoms of sleep apnea have not been diagnosed. Sleep apnea is common, and it's not only common, but it's even more common if you have certain disease states. For instance, heart failure in up to 62%, or a person who has Alzheimer's disease up to 40%. We know that there are major risk factors associated with. You can look at a person's weight, like we talked about, body mass index is greater than 32, or male predominance. Age, as we get older, it tends to peak around age 55 to 60. And then, but beyond that, even 65 has seen some increases, particularly among women who become postmenopausal. That's why that peak starts happening around 55 to 60. And then we see it commonly among people with certain anatomical abnormalities. So it's not only restricted to those who are overweight, but people with certain features. For instance, somebody with what's called retrognathia, where the chin is recessed back, or an overbite is seen, or the tongue is too large. What happens, you have all these forces: fat distribution, reduction in neurologic responses, and proximity of structures that creates inflammatory and metanephrine release, where the increasing sympathetic activity is associated with dramatic increases in blood pressure. And in this case, rising up to about 250 over 100. So in older folks, We look at their comorbidities, people with cognitive disorders or cardiovascular diseases, high blood pressure, and heart AFib as new onset disease states. And then we go back and ask them their sleep history. Because what we know is if someone has sleep apnea not treated, their risk of morbidity and mortality is much higher than those with sleep apnea who are treated. We know that it's commonly associated with motor vehicle accidents, up to a 7-fold increased risk. So here, Thag Anderson becomes the first fatality as a result of falling asleep at the wheel. So how do we identify sleep apnea? We look at their symptoms, their comorbidities, their exam, and together make a diagnosis. But you have to know the exam as seen by what you feel. Too tired during the day, too much headaches, difficulty with that sleep, not feeling refreshed. You ask your bed partner, am I stopped breathing? Am I choking? Do you see me have some weird breathing movements when I sleep? Also recognize men and women are different. Men tend to be proud snorers. Women, not so much. They tend to feel fatigued and waking up all the time at night. So we try to put things together. And here at Wake Forest, we use something called the Do I Snore 50, compilation of neck size, weight, sleepiness, and symptoms that you ask. If you are a part of the Wake Forest family of hospitals, we will actually be able to send this to you to answer on your own. And it helps us identify you if you're at risk. So let's say you are at risk. Then the next step is a sleep study, compiled of 12 different studies looking at things on your head, on your chin, underneath your nose and mouth. And these things help us identify that stop breathing effort with that no airflow. But it looks like this. And a lot of people say, man, this is really challenging. But about 85% of our patients can't sleep in the lab. But there are simpler forms of testing someone for sleep apnea, like this device called the Watch Pad, where this fits on your wrist and goes on your finger and is in fact disposable. And we use this at Wake Forest, particularly during the COVID-19 pandemic. So treatments, weight loss is important. CPAP use, helpful and has been continued to be the standard of care. Surgical treatments, not always, but there is a new therapy we offer called the Inspire device, which is called a hypoglossal nerve stimulator. A CPAP is strictly a pneumatic device, pushing air to open up the airway. It improves symptoms, decreases mortality. It's been associated with a lot of improvement in overall comorbidities. But other devices are also available, especially for those patients without comorbidities, meaning heart failure or stroke, but have mild disease and are very symptomatic. And things like oral appliances are helpful. These devices, and I'll go through them, but with time, have all been tried, but with limited success. Surgical treatment, like tonsillar or advancing your jaw, has been shown to be benefit, but only in selected patients. So then this hypoglossal nerve stimulator, something that pushes the tongue forward as you sleep, is a stimulant device that can be used and has been successful in reducing sleep apnea, but has yet to demonstrate improvement in long-term comorbidity. Other devices like this stimulant device that you can use through the mouth looks great. Wow, I can use something during the day. Yeah, but it causes some other things like excessive salivation, tooth pain, dental filling sensitivity. So check the treatment that's right for you and what your doctor recommends. But then this leads to the final thing. Why do we screen this at Wake Forest? Because we want to reduce risk. We want to improve outcomes. And we have been highlighted in regards to this issue, trying to address this problem in a prospective and progressive manner. So for us, reducing risk and improving your outcome after surgery is key. And we use quite a few steps in order to achieve this goal. But finally, just as a conclusion, sleep deprivation is something we got to avoid. Give yourself that 7 hours sleep. Avoid habits that disrupt it. As we change, sleep gets difficult, make it better. Sleep apnea is significantly impactful to your heart and cerebral vascular events. It's not always true you die in your sleep, and some people tell me how much they would prefer that. Some people wake up with a lot of conditions that could have been averted. And then recognize that sleep screen questionnaires, although maybe something you get tired of, are actually very helpful. So to finish off, one other thing to think about if you're a sleepy person, and as depicted here, I built this form around him just yesterday afternoon when he fell asleep. And by early evening, I was able to mix and pour. Thank you.
Thank you, Dr. Namen. We have a couple questions here for you.
Okay.
And the first one is, I finally found a good combination to get a good 7 to 8 hour sleep at night. Time released melatonin. Now I'm going to stumble over the pronunciation of this next one. Doxylamide succinate. DOXYLAMIDE SUCCINATE.
Uh-huh.
Is there a downside to this?
Well, not necessarily. I would always say discuss these kinds of drug interactions with your doctor, because every human body is different and some people can tolerate some meds well, some people cannot. Melatonin, by its own nature, is very safe. It's been looked at multiple times. There is some benefit to it as we get older, as I mentioned. And so, but never use in excess. When in combination with other drugs, make sure you and your provider go over something called the Beers list, which is a group of drugs that we ask for older folks to avoid. But in some patients, very helpful, and others not. So please discuss it with your doctor.
I remember you discussing at one of the earlier Aging Wells about
Uh-huh.
the timing of taking melatonin.
Right.
Didn't you say it takes a while for it to kick in?
So it's interesting when you asked the question about a time release melatonin. I didn't really address that in my response, but there are several different applications of melatonin. One is a sublingual rapid absorbing, so some that you can take right when you go to bed that may become biologically available to you and your suprachiasmatic nucleus to help you initiate sleep. But most traditional melatonins are things that you swallow like a tablet. Gets to the gut. It takes about 4 to 6 hours before it has its major impact for sleepiness. So some people think they're getting product A, but they're actually getting product B, and so they get different effects. So sometimes pharmacists are very helpful in helping you decide which one is the rapidly absorbable one that you can take an hour before bedtime versus the one that needs a couple more hours.
Okay. We have another question. What is the significance of neck size with sleeping?
And it happens to be, as the larger your neck is, it really is not the external diameter of your neck, but it's more the internal diameter of your airway. And what we know is the larger the neck, over 17.5 for men and 16 for women, is associated with reduced cross-sectional size of the inside of your airway. And that creates problems of increasing the risk for sleep apnea. It doesn't mean you'll get it. It just increases that risk.
Okay.
Okay.
Well, and I got a response back from the first person who asked the first question. He said the long name that I couldn't pronounce is an over-the-counter sleeping pill.
Right, right. Again, anything prescribed or not prescribed, I would always discuss it with your primary. Even some of the natural medications, doxylamide, or I think if I'm pronunciating it correctly, may or may not be the right drug for you.
Okay, and the list that you said we should be discussing with our doctors to make sure.
The medicines that you're on or want to consider for sleep, make sure they are not on the Beers list, BEERS.
Okay, great.
Okay.
Well, I thank you so much, Dr. Namen.
You're
It's
welcome.
always very insightful. I actually have restless leg syndrome, so I know, but it's very successfully treated. And man, there is a difference in me if I don't take my med at the right time. So I'm a believer in that. And
Well,
it
I'm
doesn't
glad.
just affect my sleep, it affects my husband too,
Right.
because it's no walk in the park if I haven't had my meds. So thank you. This is so powerful and helpful for
So,
everyone.
well,
And
Deb, it's
and I thank all of you for being here with us tonight, and just hope that you're going to join us on June 8th for our next Aging Well. And our speaker will be Dr. Ed Shaw. Many of you know him. He is a counselor, he is a physician, and he is an author. So I think he's going to be talking about caring for the caregiver. So I think it's going to be another wonderful session. And I'm just so grateful for y'all to join us. And when you get the email from me, and you'll get all the notes from Dr. Namen's presentation, the exercise notes. And by the way, the recipe that I sent everybody early, it actually serves 6. I had someone notice that the number of servings wasn't on there. It's like, is this 2 or 20? I went, okay, I'll find out from the chef. So I'll have an updated recipe that'll go out. But as always, y'all are the best part of my month. And I just thank you so much for spending an hour with us. So thank you. And we will see you next month.
thank you guys.